30-year-old single white female, regular menses. She presents for evaluation and treatment of worsening anxiety, some new onset panic attacks, intermittent dizziness, exercise intolerance. She has significant PMS when she's off oral contraceptive pills, and she desires a more natural treatment. So I first saw her in July of 2013. So social history, she's an executive in the hotel industry, rapid promotions, works long hours. She is in a long-term, very happy relationship, does not smoke cigarettes, a little bit of alcohol on weekends. She is a yogi, so she does regular yoga. She loves to run, but sadly, she had recently decreased the distance and the episodes of running because she had sort of like anxiety and panic attacks over the dizziness and exercise intolerance. So she would start to run. She'd feel kind of dizzy. She'd kind of breathe a little bit heavier, then that fed some of the anxiety. So she denied past or current abuse, which you always have to look at. So her medications were real simple: multivitamin, a B complex, oral contraceptives. We see this all the time. Personal social history, non-contributory. Nutrition, she was a vegetarian, but as we spoke about that a little bit more, she did admit that maybe that doesn't always mean healthy, and it truly does not always mean healthy. So family history, which is very important. Her mother had depression and anxiety that was being treated at the time, and her paternal grandfather probably had bipolar disorder. So I decided to order an HPA neurotransmitter test. That's hypothalamic pituitary adrenal. So that would be urine to look at the neurotransmitters, and it would be diurnal cortisol to assess the adrenal glands. Then a CBC of ferritin for the stores of iron, of course vitamin D, B12, B6 because she was on B complex, zinc. And then once she had been off oral contraceptives for a couple of months, I did want to do a luteal phase estradiol progesterone just to see if there was any overt imbalance in that regard. So a couple weeks later, the lab results come back. Her CBC was normal. She had suboptimal ferritin of 23. Previously, she had been unable to tolerate oral iron, so this was something that she knew. She was sort of, quote, anemic, unquote, but she didn't really know what that meant. Her vitamin D was all right at 41. I wouldn't call that optimal, but it's okay. Thyroid indices, according to her primary care doctor, were good, and her fasting B6 was just a little bit elevated at 35.7. So then the results of her neurotransmitter testing showed serotonin was suboptimal. So if you're looking at the chart, you're looking at the optimal ranges and then the reference range. So optimal ranges are where you want to go. Those are people that seem to feel the best, especially when they're treated. So I kind of zone in on that. So she's low in that regard. GABA is really good, and that's could possibly be a little bit elevation as GABA, tries to work with serotonin and kind of help those inhibitory neurotransmitters. Dopamine, a little bit low at 126.4. Norepinephrine, okay, no problem there. Epinephrine, a little bit low, so she's not really converting very well. But interestingly, her glutamate was a little on the high normal to high side, and this is a vegetarian that is, quote, healthy, although she says, well, maybe not quite so much. So you think glutamate, so that would be monosodium glutamate, like a lot of processed foods, or it could be that she has a high sodium diet. And if you look on the back of a label and it says sodium, the FDA doesn't make manufacturers differentiate between sodium chloride and monosodium glutamate. So that's always something to think about. And then her epinephrine to, or norepinephrine to epinephrine ratio was okay, it was 3.9. And then looking at the cortisol, the various cortisol values, that would be early morning, around noontime, supper time, and then before she went to bed, she was a little bit elevated at 6.6, around 12. So the first thing I ask is, well, what happens at 12 o'clock? What is stimulating that release of cortisol? And as she said, well, that's a no-brainer. It's when everybody start waking up and emailing, and people from all over the country, and what she does for a living are all at her. So her life is getting really busy right then. And then you can see that her DHEAS from her adrenal markers were right in the middle within normal limits. So her cortisol, so her adrenals were doing okay, but they were a little bit under stress. So therapeutic recommendations from the very first meeting with her was we needed to provide a supplement called Prolent that would increase her serotonin, not too much, just a little bit, one a day. Procite-d does help with procite-d helps with dopamine, but I didn't want her to start that right away because that can give you some energy, and it can also cause a little bit of anxiety. So I wanted her to sort of get calmed down first. There is a wonderful supplement called Tranquilint, and if you take one or two of these chewable, natural anti-anxiety supplements at the onset of anxiety, you can oftentimes abort that feeling. So you can use it with your deep breathing or whatever and just calm yourself down a little bit. So it's really good to use at the beginning of treatment before serotonin or the inhibitory neurotransmitters are elevated, and then things start happening maybe without the Tranquilint, but it's good in the beginning. I asked her to watch her foods that were high in MSG and salt. We also talked a lot about optimizing nutrition for vegetarians and what that means and what we could do with that. She was asked to think about music therapy or meditation just 10 minutes before lunch to see if just that little quieting of her inner self could maybe help those noon cortisol levels. Maybe close the door, don't answer the emails, just pretend she's on a conference call. Also, I asked her to discontinue her B complex due to the elevated B6. Sometimes the increased energy that you get off of B6 is interpreted as anxiety. Also, I asked her to try again some over-the-counter iron, 2 tablets every day for a month, obviously on an empty stomach with maybe a little bit of vitamin C, and then 1 tablet every day until the next test. So that was for her low ferritin. Gentle exercise, maybe a run walk, which that was gentle for her. Increase her yoga practice. Begin to do some cognitive behavioral therapy, meditation, deep breathing, whatever, at the onset of dizziness. And then for the elevated glutamate levels, I suggested some NAC, NAC, 600 milligrams every day, and CoQ10, 100 milligrams every day. That sometimes can help bring down those glutamate levels, especially if you're watching your diet as well. So while that seems like, gosh, that's a lot, really it isn't. You can provide a sheet of paper. You can tell them it's just not a very, it doesn't take too much time. So then visit number 2 was 4 weeks later. I like to follow up and see how they're doing. Everybody comes in after about 3 to 4 weeks of starting the therapy. So she said she was much improved regarding anxiety and overall felt much calmer. The Tranquilint was beneficial, especially when taken at the onset of anxiety. She was finding some small improvements in fatigue and dizziness. The Prolent did cause some insomnia. Sometimes you can take the serotonin support at night, and it causes a wonderful sleep. Other times, rarely, but sometimes it can cause a little insomnia. So I just said take it at dinner time or in the AM, and that worked well. So her lab results, her ferritin 4 weeks later had increased to 55 from 23, and her B6 was now normal. So that was pretty good. And she, her symptoms reflected that. So you can't just look at a lab value without looking at symptoms. So subsequent visits from October of 2013 through February of 2014. So the way you look at this slide is you can see test 1, test 2, test 3. So basically you're testing about every 10 to 12 weeks to see, how your therapy is going, your supplements. And she was definitely increasing in serotonin, and her mood and her symptoms reflected that. Her GABA came down, which is absolutely normal. That's what happens. As serotonin sometimes begins to increase, GABA then says, oh, gosh, I don't have to work quite so hard, so now I can become more into the level that I want to be. So that sometimes goes down as serotonin comes up, and that's all okay. It doesn't mean that you're more symptomatic. It just means that it's equilibrating. So dopamine is coming up a little bit, even though she declined treatment for it, probably related to the increase in serotonin. Epinephrine, norepinephrine still a little bit low. That's more of a, because of what's happening with the dopamine. They all kind of line up together. Glutamate became much better, so it went from 15, actually, it went up on the second test, back down to 8, and her ratio of norepinephrine to epinephrine was good. So that's awesome. And then her adrenal glands were all within normal limits. Of interest in the second test, when you see cortisol 1, that's the morning cortisol, of 14.5, that was a sleepless night. She had a job interview the following day and she wasn't sleeping. So, that was kind of like a false elevation, but it was cause effect. But everything started to come on down with some of the different, very, very, very simple treatment modalities that we discussed. And again, looking at the DHEA on the second test, it went up to reflect what was happening in her adrenal glands the night before, but then for the most part, everything was looking good. So how is the patient doing now? So we keep in touch, and her symptoms slowly resolved over time. She's doing extremely well now. She rarely has anxiety. She knows when it's going to happen. It's just not out of the blue anymore. It's very well controlled with the stress reduction techniques and the supplements, and she rarely relies on Tranquilin anymore. Fatigue is improving. She has no dizziness or exercise intolerance, which that's from most likely the ferritin levels coming up a little bit. She has started running again, and she's now training for a half marathon, and of course her glutamate levels normalized. So her treatment plan, she's getting ready to retest again, actually, I think next week. Prolent will just adjust the dose as her serotonin levels sort of go up and down if they do. We'll do the Lentro 1 twice a day for GABA. She'll do Tranquilin as she needs it. Really and truly, she doesn't need the NAC or the CoQ10 anymore because her glutamate levels normalized. And she has now discontinued her birth control pills. And we'll test her hormones this particular month. She's getting ready to go to the lab soon, cycle day 19 through 22. And the best part is she referred her mother. So is that not the ultimate compliment, is when somebody refers a family member or a really good friend. So that's wonderful. So that was truly a really good outcome for this young woman.